Welcome to Season 2 of Unprivate Parts. This podcast is a space where women can feel supported and understood as we have open, honest conversations about women's health and the uncomfortable subjects we all want answers to. In this season, we will explore the complex realities of breast and gynecologic cancer journeys, breaking them down with empathy and expertise. From hearing the words, "you have cancer," to making decisions, undergoing treatments, navigating survivorship, and seeking support, we will cover it all. Nothing is off limits, and no topic is too uncomfortable to discuss here. This is Unprivate Parts.
Welcome back, listeners. Hi, I'm Lauren Smith, the Manager of Business Development here at Women's Hospital, and I am joined with my friend and also breast surgical oncologist, Dr. Lindsey Fauveau, in our Series 2 of the Unprivate Parts podcast. So today we're going to discuss the natural urge to want to hit the search bar and learn as much as you can before, during, and after a confirmed cancer diagnosis, and all the panic and things that come with that. But does unlimited access to information AI benefit us or lead to more confusion? We'll guide our listeners on when and what to search for, how to distinguish between fact and fiction, the importance of relying on your healthcare team for accurate information, and strategies for navigating the internet wisely. Dr. Fauveau, thank you for being with us today. Could you please share a bit more about yourself for the listeners? How did you come to be a breast surgical oncologist?
Thank you, Lauren, for having me. Grew up in Gonzales, went to high school in Baton Rouge. I went to St. Joseph's Academy, and so I have roots in the community. So whenever I did training, I trained at LSU for surgery residency, and then I found a special interest in breast, and I really love taking care of breast patients in general. I think the diagnosis has changed dramatically over the last 30 years, and I wanted to bring that back home. It does also go without saying that living close to your parents is automatic childcare. So I'm not going to deny that that is a draw, but I think that it's important to understand the community that you treat. And so coming back home was not only rewarding, but very important. I've never liked in my history of medicine understanding that we sort of are in a race to the bottom with Mississippi. And so if we can do anything to make that better, I'm more than willing to be a part of that. But I went a little bit out of the region for training. I went to Dallas for fellowship at Baylor, but I do love Baton Rouge as a community, and I think that there's a big need here in Baton Rouge for breast specialists in general.
Let's dive into the real meat of why we're here. We're talking about all of the resources available to us today and patients wanting to do their own research, and maybe they get hyper fixated on, let's formulate a plan now. Why do you think there's such a strong urge to search for information when someone hears the word cancer, sometimes before the diagnosis is even confirmed?
I think the whole process of being diagnosed with cancer is burdened with anxiety. You're getting a imaging modality. In the case of breast, you're getting a mammogram. So you already are out of the normal box of going to the doctor, having that conversation, checking the box, leaving, having an appointment for a year. So you're thrown off of your normal routine. And so as a human, that alone is very alarming. And then you get asked to do things that are foreign to you, like, for example, a biopsy. And then you're told, okay, well, there's this other kind of doctor that you've never even heard of called a pathologist who's going to look at your tissue under a microscope, and then they're going to dictate what happens in your life moving forward. And that concept is very strange. And once you meet a pathologist, like a whole new conundrum of questions pops up. But then you have this waiting period. We don't have a fast pass to getting your diagnosis. And that waiting period, when I reflect back with my patients, is probably the most painful part of this whole process. And so what do you do with that energy? And there's no magic wand to say, like, you need to be this way. You need to just sit with it. You need to have the mental fortitude to sit with the unknown. I think that everybody has their own personality, their own way of processing things. So whenever it comes to that, it's difficult and there is no correct way. But unfortunately, we do live in a society where we have instant information and we live with a device in our hands, whether we like it or not. And so you have an easy button to fill that space, and you can let your mind either settle or wander, and what you do at that time can either be productive or not constructive. And so we have to be okay with however they process that. It does not mean that they are not going to receive the information from your physician, but it is part of cancer care in general.
And you're so right. We have everything available at our fingertips, access to our medical records in the palm of our hands. And that, like you said, that can include our test results that we not necessarily have talked to our doctor about before viewing those. Should people wait to hear from you rather than clicking that notification? Or what would you guide your patient, let's say on my chart? You get your test result, trying to decipher it yourself.
I think having that conversation up front, whenever you're not having that normal patient physician interaction, if they are asking something of you that's going to have a result. And so during that initial encounter where they're telling you, I'm going to have you do this, or I anticipate that we should have an answer via something that may come through my chart, at that moment, it's completely appropriate for you as a patient to say, okay, well, how am I going to get those results? What would you like me to do? And whenever I see breast cancer patients in clinic, I give them an approximate time. I know that woman's has a process where after a biopsy, your pathology roughly comes out within 3 to 5 days. And I ask them, do you want to come back in a week? Will you receive that information better in person, or are you okay with the phone call? And is that way of communication okay with you? And so it's okay for you to be the one to instigate that.
So you do give the choice.
I do. I feel like I can't, in the short amount of time that I'm talking to somebody, it's very, very difficult to understand what is their true temperament. Is this someone who is okay sitting in the unknown, or are they going to be more grateful knowing, even though I won't see them, 1 hour or 2 hours later? Just having that knowledge sometimes is settling for their mindset. And so if that's something that can serve them, I'm more than happy to have that conversation. Now, I do lay ground rules. I'm not going to come into the office at midnight to have a conversation that can be had at 8 a.m. the next morning. But there are patients who do tell me that they were able to sleep at night just knowing that they had a plan. They knew when they were going to have that conversation. And so it's really naive to think that we know it's going to fit with somebody and not with another person. So it's okay to ask. It's okay to offer that. As a patient, it's absolutely okay to say, I don't know what your process is, but I would like to know as soon as possible. And this is the methodology that I want.
That is so comforting, because you can spiral thinking, do I have to wait? All the things your brain can come up with. And so talking about, let's say I do try to decipher my own lab reports on my own, the imaging summaries. What are some of the risks that patients face when they try to take that upon themselves before talking to you?
I think that whenever you seek information, it's just like in teaching a child, your first impression of that received information is always going to leave a lasting impact. So if you're going to take a lab or an imaging modality or your pathology and input it into some AI search device or, whatever product it is, and they're going to give you a result, you're going to absorb what that told you. And if that is in any way in conflict with what your doctor says, you have, in effect, put yourself in a mindset where you're not going to receive the information wholeheartedly. You're going to start to question things that otherwise wouldn't have been on your plate, and can lead to a little bit of disruption. Now, I will say in this instance, I have had patients come to me and say, I took this pathology and I put it into this AI program and this is what it says. And I'll go line by line with them and I will say, correct, incorrect, these are the reasons why, correct, correct, correct. And that does not bother me, but the underlying ramifications of that are, what do they do once they leave? Does that upset your mindset? Are you someone who can readily be about-faced and take that information and be productive with it? And so I think that it's not a one size fits all answer, unfortunately. Sometimes people process new change better with more information, and sometimes people process new change detrimentally with more information. And you have to know yourself enough to know, is that going to be good for me or not?
And with all of the AI available to us, such a hot topic these days, you're inadvertently sharing your personal health information with AI tools. Can that end up, I don't know, in another country, or somebody has your...
I mean, look, it's so tempting. I kid you not. I almost fell prey to it the other day because I went and got my color analysis because I needed to know why I felt like I was wearing the wrong pink at breast cancer.
There is no wrong pink.
So, yeah, I mean, if you have pink undertones, apparently there is. But one of the nurses in surgery said, oh, well, I mean, I took a picture of myself and put it into this AI search engine and they did it for me. So why would you go to a human and have that done? And I said, what? You gave them a picture of yourself? So if that is considered acceptable behavior, I think it is a slippery slope to say, okay, well, the world knows what I look like, what my children look like, what my family looks like. Where is that line drawn where you are sharing things that are supposed to be privileged and they're protected by law? And what is that information being used for? And so I think there needs to be a little bit more public awareness of how that process happens.
Kind of scary. Have you heard anything about these AI tools can occasionally experience hallucinations? So generating confident answers, even when they're wrong.
Yeah.
What should the listeners know about this phenomenon?
I think that the fact that these tools do not immediately lead you to their sources and in its entirety is problem number one. Whenever we practice medicine, we have to have it from verified, credentialed sources that are scientifically proven. They're the standard of care of medicine, have gone through the rigorous scientific method. And so you run the risk that these programs are pulling from unverified sources. And so there is this entity where the information ends up being interpreted and delivered with bias, unfortunately. So depending on where it's pulling from, you can get misinformation, disinformation, and it can ultimately lead to a clouded conversation with regards to your health information. It's kind of scary. Even in the field of medicine, I don't cross those boundaries. I'm not pretending that I know how to deliver a baby. I did it once in med school and I said, that's enough.
What did you deliver? A boy or a girl?
I delivered a girl via C-section, and I love the operating room, and that's about as much as I can say about it. But I don't pretend to be a pathologist. I don't pretend to be a gynecologist. I treat breast and breast cancer. So I'm not delivering my advice about anything other than that.
What types of questions are better suited for a conversation with a physician rather than Google or AI?
I think the hard part about that is that when patients come to the doctor, unfortunately, I hate that there's this sort of prescribed mentality that there's only a certain amount of time. So I feel like people come into a visit and they have this preconceived notion that they need to get through the visit in order to make it to the next step. That is your time. Your time can be spent however you want it to be spent. You can ask all the questions you want in that time. If your questions do not fit into that time, ask for more time. If you don't ask those questions, you're going to be left to answer them yourself, unfortunately. And so kind of how my mentality is whenever I go to a professional like a CPA who's doing my taxes, or heaven forbid, a lawyer that's representing you for anything, I have no clue what they do. So I'm going to ask them what they do on a granular level because I want to not walk away and try and figure out what I didn't grasp. And so I try to lead in my cancer conversations with, what is the thing that kept you up last night? Or what do you think about all of this? An open-ended statement has led me in like 18 million different directions, which is why I think I have so much insight into how everyone processes this information differently. I will, in a calendar day, that question, those two questions, either or will fit, will lead me to, well, I don't have a trust set up for my grandchildren. So that far into like I'm dying. all the way to, well, I had a dermatology visit today and this was at this time and I feel really inconvenienced. So it's the spectrum of I don't want to be here, I'm not engaged in my healthcare, to I'm dying and I need to set everybody up. So you really don't know where you're going to land. And so you have to have the mental flexibility to meet them where they're at.
How can patients bring the information they found during their own research into a conversation with you without them feeling embarrassed and overwhelmed?
I think that can happen in many different ways. If they've absorbed the information to where they can follow the conversation, they can ask pointed questions and say, my interpretation of my results is this. Do you concur? Or push with regards to what is communicated to them. And if it is in line with what they found, they get validation. If it's not, then I think you need to ask more questions. If you really want to be sort of blanket statement, I think that you can send that information via my chart and say, can you take a look at this? Does this look accurate? This is what I found. If this isn't accurate, then tell me why. I think that my chart gives you access to things in perpetuity, which is nice because you can look back at your prior imaging. You can see how you got here. I feel like that happens a lot in the middle of the night for cancer patients. They look back and they say, okay, well, my last study was this time last year, and I wonder if it was there then. Or they do the reverse. They're through survivorship and they look back and they say, man, 5 years has gone by already. But that tool also is used as a vector of communication. So if you feel as though you don't have the capability to have that conversation, do it electronically. I mean, at this point, sometimes it is easier to text than it is to verbalize it, especially if you feel like you can't quite grasp the terminology. Send it with a specific question and you'll get a response. And whether or not it's a phone call or a written response, you at least feel heard.
I love that because so many of the medical terminology terms or acronyms, they can be very daunting and just scary to hear. With that said, do you have any examples of good online research that can help inform a more productive conversation instead of Googling just what is a biopsy or a specific diagnosis? What are some good examples of online research?
I think at baseline, you can go to whatever cancer diagnosis you have, and there's going to be a foundation. There's going to be a verified foundation that has survivor communities. There are local hospitals in your area that are going to have resources that are verified. A hospital is not going to put misinformation or disinformation out for the public. So American Cancer Society is a nice global one that will cover all of your bases when it comes to cancer. You can also find information if you look through individual studies. So I know mostly breast, but NCI, National Cancer Institute, has a data bank of all of their clinical trials and their published papers. So if you have a very specific question, you could be as granular as searching something very specific within an NCI database, or you can go to American Cancer Society and get something more global. You can go to whatever disease process you have, and they're going to have things in each of those. So for example, for breast, there's Susan G. Komen. You can go to the Women's Hospital website for breast and gynecological cancers. And then you can even sort of go a little more granular by going to each of the independent societies. So I'm part of the American Society of Breast Surgeons. If you know that you're going to need a breast surgeon, you can go to that website and that will lead you to verified websites. If you're going to a gynecologic oncologist, they have their own independent society that will have their recommended resources. And so there's lots of different ways that you could get there, but I would just make sure that you're not going to a place that typically is in the top 3 portions of a Google search because they're all paid ads.
Right. And I noticed you didn't mention TikTok.
No.
So the TikTok doctors out there, I say that in jest, but that's probably not the most credible place to get your information doing your research. So you talked about those could be potentially misleading and finding credible sources. Tell me a little bit about what are some of the biggest myths or misconceptions about cancer that you've encountered with any of your patients?
I think that in particular, the word cancer immediately indicates that there's going to be a soon end of life. I was driven to breast cancer as a specialty because the vast majority of my patients survive. I mean, I can't say the same for my surgical oncology colleagues who treat very hard diseases like pancreatic cancer, but People do really well, even in stage 4. We have long lasting survivorships because of the new and innovative medicines and technology that's come out. And so I think that, of course, it's not a word that people want to be associated with, but there's life after it. And so to dispel the connotation that cancer equals death is, I think, an ongoing process.
And if you could give one piece of advice to someone who is tempted to start doing their own research immediately after hearing the C word, what would you tell them to do first?
I'd say if you really cannot resist the temptation, it's okay. You can do it. But I want you to track where it leads you and then exit that browser or whatever you're on, exit that TikTok, exit that Instagram, the browser that you're looking on, and do it again and see how different of a result you can get a second time. And that should tell you all you need to know.
Thank you, Dr. Fauveau, for sharing such valuable insights and helping us untangle the web of information surrounding a cancer diagnosis. We hope today's conversation empowers patients to look for credible information, lean on their care team, wonderful staff, and avoid the digital rabbit holes that create more confusion than clarity. Thank you for listening, and we hope you'll join us for the next episode of Unprivate Parts.
Thanks for joining us for this episode of Unprivate Parts. Don't forget to subscribe to our podcast so you never miss an episode. For more women's health tips and cancer-related content, follow Women's Hospital on Facebook and Instagram. If something you heard resonated with you, please share it with others. Thank you for listening.